inflammatory response here as well. As well as having a look at the lashes. You have very long lashes, nice and full. Any of that inflammation is developing in the hand. We're just going to feel around. Just having a look at the hair. I might be performing a couple different things. I think I'm going to start by actually just going to move your hair to the side if that's okay. So since you said you were experiencing most of your symptoms on the left side, I'm going to focus my attention here. So I'm just going to be visualizing your skin, having a look externally for any signs of abnormality or concern. Moving your hair slightly to the side, exposing any covered areas so I can ensure I'm not missing anything. Just going to have a look at the overall skin texture and complexion. Do some palpations along the bony areas. And get a feel for the overall skin texture. So, getting my exam. Just keep your eyes closed for me, Lucy. I'm going to shine a light across the surface of the skin. Just want to look for any abnormality of the hairline, of the surrounding areas here. Also just looking at the brow, pulling up gently at the brow bone, as well as having a look at the lashes. You have very long lashes, nice and full. Having a look at the face, overall complexion is very even. Nice and well moisturized, and as I look just at the neck, coming down towards the thyroid, looking over the throat, not noting any signs of swelling or edema here. Coming down towards the clavicle, having a look along the collarbone. Looking at the normal shadow here, that does appear to be well indented. Collarbone appears to be symmetric to the other side. No sense of displacement or asymmetry as a whole at the clavicle. As I come down and look at the shoulder, down to the ulnar region, I don't see any signs of asymmetry there. Coming down, centered with the breastbone. The skin again is even in texture and complexion. And if I have a look at the hair itself, just a brief check for hair integrity, any abnormality in texture, checking for thickness and opacity. Any changes as we come down the shaft. And visualizing at the ends of the hair, looking for any signs of excess breakage or damage. Overall, hair does appear fairly healthy. Just going to move that aside here, Lucy. I'm going to have just a very brief look at the external ear. Just visualize here. Just going to have a look at the external ear. Look for any signs of concern there. Just using this aerated tool. It's a little pipette to apply very gentle pressurized air. This will allow me to dislodge any possible dead skin cells or anything lingering on the surface of the skin, but don't see anything there. Just gonna have a look here at the lobe, the piercings. Do appear to have healed nicely. And as I have a look at the hair itself, just looking at overall strength, using my tweezers to gently tug at the follicle for any signs of gumminess or breakage or weakness at the root. As I come down, I'm going to use my metal sticks here to just have a look at the neck area. I like to just be sure to look underneath any jewelry in case I'm missing any signs of irritation. To gently displace this. Surrounding skin does look okay. As I come down towards the clavicle, looking for any signs of swelling or irritation. Just going to test the skin integrity here. For signs of loss of elasticity, any irritation on the surface of the skin, or any roughness. Just using these to kind of pull the skin taut in either direction. Looking down the arm. Again, skin is very smooth, nice and even. No signs of sun damage, aside from a few freckles. I do see a couple freckles here on the chest as well. So just something to note whenever you're going outside for extended periods of time, especially in the summertime. Make sure you're wearing proper sunscreen. Just looking at the jawline. Very good. Your skin is also nice and clear, no signs of active blemish. Breakouts. So Also very well moisturized, nice and plump, appears adequate amount of collagen is being produced as your skin is very full. No noticeable fine lines. Certainly not any wrinkles at your age. Very good. I'm going to go in with this tool, and this is going to allow me to check for any signs of inflammation. So this is one of our main concerns for today's visit. It's going to feel very cold. Just to give you an example here on your chest, you're just going to feel a cold, smooth sensation. So I'm going to start here at the hairline. Just very gentle strokes, about 3 inches at a time. Just going to gently come down towards the temporal region, and this will alert me of any concerning areas. Anything that's showing active inflammatory response. So testing at the jawline just along your chain of nodes. And just along your neck. Before moving down to the clavicular region. Just over the collarbone, pausing at the shoulder, coming down towards the axilla, gonna go down the forearm, stopping at the ulnar bone, coming back up towards the scapular indentation. Pause and hold, as this is a place where I tend to see excess tension build up. So I'm going to come forward, down towards the chest wall, holding just over the heart. And again, no positive indications here. This would alert me of any signs of aortic distension or any cardiovascular concerns, abnormal rhythm. So far, none of that is notable. Go back up here, Lucy. Just going to turn you very slightly. Moving just a little bit closer to you. I'm just going to use my comb to have a look briefly at the scalp. Just looking at a couple sections here, closer to our area of concern. Looking over the skin of the scalp for any signs of redness or irritation, any increase in flaking, any signs of infestation. Coming down the length of the hair. Also do want to have a look at the nape of the neck. I'm just going to turn you slightly here, Lucy. Just going to move your hair gently out of the way. So I have a look here at the side and back of the left side of your neck. Again, this is where we were experiencing some of that excess tension. So as I have a look here at the shoulder, I am seeing some signs of mild inflammation just here, slightly above the scapular indentation, kind of lateral to the cervical spine. And as I visualize along the neckline, I do see maybe some mild inflammatory response here as well. So I'm going to palpate around. So I'm just going to feel with my hands. Feeling here at the collarbone. Just going to feel around the musculature. Do feel some mild pressure here at the shoulder. So I'm just going to continue to palpate around. Feel for any swelling as I come over towards the center of the chest wall. Just going to palpate around and pay some attention directly along the clavicle. Just make sure we're not missing any signs of inflammation here. Nothing that could suggest any illness or infection. Or just a long neck here. So make sure there's nothing that indicates any concern here. Briefly feel this side of the neck. Not feeling any inflammation here, although it is slightly warm. Just going to bring you back centered, Lucy. And continue my examination. Palpate along the neck. I do feel a little bit of excess tension here. Is that tender at all? A little bit. Have a look at your hand, Lucy. I just want to see if any of that inflammation is developing in the hand. I'm just going to bones in your hand. Do you feel just a little bit of coolness? Just a little bit cool. Just being sure to feel in between each individual bone of your hand. Doesn't feel too bad, just some mild abnormality in your circulation. So I'm just going to have a look at the wrist as well. Looking at the bone, the structure of the bony prominence. It does feel good. As I look at the skin of the hand, it's nice and smooth. No abnormality in skin texture. Very good. Very loose. So I think the last thing I'm going to do is just do some reflex response. So I'm going to touch you with a very cold object. So it's going to feel just like this. I do want to warn you, it is very, very cold. And I'm just going to touch this to the surface of the skin. You don't have to do anything specific. I'm just looking for a very specific response and reflex. You have several muscles of the face and of your body as a whole, and as I kind of bring it to the surface of the skin, your body reacts in anticipation. Just touching it to the surface of the skin, looking for that reactivity. I am seeing normal response here. It does appear as if your body is reacting appropriately. Now, as I continue to touch you with it, it does pick up the heat of my hand as it is conductive. So I'm just going to try to alternate sides. Continue to test for reactivity. We tend to be more receptive in areas like the back or neck. If I test with something a little more soft, we should also see reactivity there as the stimuli increases surface tension and also just provides a different neurological response to stimulation. So just alternating with my hand and the tool, testing over different areas. Overall, seeing very active levels of reactivity of a slightly abrasive surface. Nothing that causes pain, but just a little more specific of a sensation in comparison. If I alternate, you're more likely to react out of anticipation. And I would say all of that constitutes an appropriate response. All right, Lucy. I did see a few things that you were describing. I noticed a bit of the increased tension, specifically of the temporal region and a bit of the nape of the neck as well. You do have just a little bit of that swelling here, as we discussed. Now, aside from that, I noticed just a little bit of kind of loss of circulation of the hands. So that is something that I think we may need to look into further. So I am going to put a follow-up appointment in my books for about 2 weeks from now. I'd like you to come back in and we can perform a reassessment, see if we're either seeing any progress or if your symptoms have gotten worse. Okay? All right. Do you have any questions for me, Lucy? Okay. I'll go ahead and put that in for you, and I'd like you to get home safely.
Thank you so much.
Thank you. We're going to start here at the top of the scalp. All of that just gently underneath the eyes and around the mouth. Sensing some release there. And I like to do bilateral tests here so that I can really tell if there's any significant difference from one side or the other. Yes, slightly more. Specific response on the left side. So I'm sensing a need for some brushing. So I'm just going to have you rest your head here for me. Just going to very delicately brush along the brow line, directly above the eyelid, down across the lash line, directly underneath the eye, following over the medial line towards your left side, up along the brow bone, down along the eyelid, softly across the lash line, and just below the eye. Then I'm going to go in with a bilateral stimulation. And we're just going to trace both sides very softly along the ears. Gentle strokes around the earlobe. And down along the neckline. Just going to expose the shoulder. Good. Soft tracing at the scapular indentation. Ever so gently tracing along the lines of some clothing. Tracing along the chest wall. the hairline.